Good afternoon, everyone. My name is Takesha Miles, and I'm the supervising attorney of the Elder Law and Fair Housing Programs at Legal Aid Society of Palm Beach County. And I want to welcome you to today's webinar on COVID-19 vaccines in seniors. So we want to talk about the COVID vaccine and scams that present seniors with different types of challenges and how to plan for your healthcare and provide for your healthcare needs in the future during the pandemic. And so I want to just take a moment and thank the sponsors for today's webinar: Legal Aid Society of Palm Beach County, Global Health and Community Service Incorporated, the Florida Statewide Organization of Omega Psi Phi Fraternity Incorporated, Quantum Foundation of West Palm Beach, Area Agency on the Aging for Palm Beach and Treasure Coast. We have three wonderful speakers today. Our first speaker will be Dr. Keith Crawford. Dr. Crawford is the Health Scientist Administrator and Program Officer with the National Institutes of Health, which is in the National Institutes of Allergy and Infectious Diseases. He's previously served as a research associate in the Division of Clinical Pharmacology at Johns Hopkins University School of Medicine in Baltimore, Maryland. Dr. Crawford received his Bachelor's of Science degree from Cornell University, a Bachelor of Science degree in pharmacy from Temple University. He also completed a residency in clinical pharmacy at the National Institutes of Health Clinical Center and a PhD in pharmacology from the Uniform Services University of the Health Sciences in Bethesda, Maryland. We are happy that Dr. Crawford has joined us today to provide an update on COVID vaccines and seniors. And we want to give a warm welcome to Dr. Crawford.
Thank you very much. Are you able to, can you hear me okay?
Yes, we can hear you.
Okay, great. Thank you. First of all, let me express my condolences for the loss of your colleague. I know that's been very difficult for the members of the organization. And also, let me thank you for the invitation to come back and speak. I last spoke with you about 1.5 years ago. And so the question is there a light at the end of the tunnel? And let me just say that the progress since that time has been substantial. So let's look at where we are now and actually look at where we are now and where we have been. And so this looks kind of crazy, but this is the trajectory of the COVID pandemic. And we're looking at two different things. In these blue bars that you see are the number of weekly cases. They're the weekly COVID cases in the millions. And so we can see over the 2 years of the pandemic, we see them going up, we see them coming down, we see this bump, this was the Delta wave, we see things getting really out of control with Omicron, and then second Omicron, another Omicron wave. This is where we are right now, where we're probably somewhere around 250,000 cases a week. In the yellow, we're actually looking at deaths. And these deaths are shown as death rate per 100,000 in the population. And so what you see here is we're a little bit less than one person dying per 100,000 in the population. So that's quite a bit of distance from where we are up here, where we had almost 7 people dying per 100,000 in the population. So it's amazing progress, but again, people are still dying from this pandemic. So keep that in mind. I want to show you some data from Florida. First, in these greenish bars, we're looking at the number of cases. These are data that are updated from the Florida Department of Health. We see a steady decline in the number of cases, which is really good. Looks like we're plateauing here in October, but it's not continuing to go down. It may actually be going up. And this is kind of the trend that we're going to expect to see for the country as we go into winter. The cases may actually start to increase. One thing that is promising, we look down here in these purple bars, are the vaccinations. And so we see as we move closer into winter, we see increase in vaccination rates. We also have a new vaccine, which hopefully people are going to be utilizing. We'll talk about that vaccine shortly. Now, one of the things I want to do is make you all junior scientists. So I'm going to be showing you some actual data. It may look scary, it may be a little confusing, but we're going to try to go through it so that you can really get a core understanding of what has happened during this pandemic. So this is a very scary figure, but it actually is fairly easy to understand. So let's start at the bottom. What are we looking at the bottom? This is from 2021 in May all the way to the current period. And what are we looking at? We're looking at the changes in the pandemic. What we are really looking at is the evolution of COVID variants over time. So if we start out here in this bluish or purple, we see the Gamma variant. Remember, we started giving these variants Greek letter names. And it's pretty scary because we've almost gone from Alpha to Omega already because these variants are evolving pretty rapidly. But we start out with Gamma, and then you can see here around what looks like June, a little tiny bit of green that quickly, very quickly takes over. This is the Delta wave. This is Delta. It starts out where we detect a little bit of it in the population, and next thing you know, it takes over the whole thing. All the stuff that we see is Delta. Then right here around November of last year, we start to see this orange. What's going on here? This is a new variant. This is the Omicron variant. And over time, as you can see, Omicron takes over. Now, if we just take a look up here, what's going on? This is what we call in genetics a phylogenetic tree. And all this is telling us is that during these different phases, these are the mutations we're detecting. These are the mutant variants. So we see in green during the Delta phase, these are the mutations characteristic of Delta. But then when we get to Omicron in the red, we see a whole lot of diversity. We see a whole lot of mutations. And this is what happened with Omicron. Omicron has a ton of mutations. Why are these viruses coming up with all these mutations? What's going on? And this is essentially what every organism does. This is, again, mutation. This is evolution. And let's see what is going on here. So we look over here on the left panel. This is a diagram, a cartoon of the coronavirus. This is what it looks like if we were to use a high power microscope. And I like to say that these are like a soccer ball with spikes, a soccer ball with spikes. These red spikes that you see are called the spike protein of the coronavirus. And this is where most of the mutations are occurring. So why are the mutations occurring in the spike protein? One is that the spike protein allows the virus to get into our cells and into our body. This spike protein is what the virus uses to latch onto our cells and infect our cells. So you think of the cells in the upper respiratory tract, like the nasal passages, in the throat, the virus gets in, spike protein allows it to get into the cells. The mutations in the spike protein are altering the structure so that the virus can get in easier, so that it can infect and spread easier. So this makes a lot of sense. The organism is trying to expand itself. The other thing about the spike protein is it is the part of the virus that is most easy for our immune system to recognize. So when this virus gets into our bodies, the immune system can very easily see these spikes and it can produce antibodies against it. And that is bad news for the virus. So the virus tries to change the structure of the spike protein to escape the immune system. And this is exactly what happened with the Omicron variant. It has more mutations in the spike protein than any of the other variants. I'll just point to this study here that looked at Omicron's infectivity and immune escape. This was a study that was published earlier this year in the journal Nature, which is one of the leading biomedical research journals in the world. And what they say here is that the mutations to the spike protein of the Omicron variant are shown to alter how the virus infects cells and reduces sensitivity to therapeutic and vaccine elicited antibody. So exactly what I was telling you, this is what Omicron does, and this is what Omicron is continuing to do. And whatever Greek alphabet come after Omicron, they're going to be doing the same thing. But we have a COVID toolbox, and this toolbox has a lot of defenses and protections in it. First and foremost, we have the masks. And the important thing about masks is that they work. Doesn't matter what the variant is, doesn't matter what the subvariant, doesn't matter how many mutations or whatever, masks work. We have new vaccines, a bivalent vaccine that I'll talk about shortly. We have another very important tool, which is home testing. Very important that we didn't have the last time we had, I presented to this group. We have a very powerful tool. We have oral medications. And then we have another treatment, the monoclonal antibodies. So let's take a look at what's in our COVID toolbox. Let's take a second to look at the diagnostic tests. So what are these tests detecting? When you take a COVID test, what are you looking for? How is the test working? One type of test that we use is called the PCR, or polymerase chain reaction test. And what this test detects is the coronavirus genetic material. This is detecting genetic material. In the case of coronavirus, it's RNA. So this detects the RNA of the coronavirus in a swab, in your blood, wherever we take the test. It is the most sensitive method. So when someone says PCR, I need a PCR test, they want it to be the most precise test. But it's a test that generally takes longer to get the results. And one of the reasons it takes longer is because it requires special instrumentation to do a PCR test. There are also antigen tests. And what do the antigen tests measure? They measure the antigen, the viral antigen, which in this case are the coronavirus proteins. For example, it could be spike protein, it could be another protein called nucleocapsid protein. And so these tests, this is a simpler type of test. The at-home test that you're gonna do is measuring antigen. So it's much more rapid, but it's a little less sensitive. There is a different type of test that we don't usually use, so I'm not going to talk about it. But the thing to keep in mind with these tests is whichever test you use, there is a window period. There's a time after you're exposed to the virus that you're just not going to be able to detect by any of these methods. You're just not going to be able to detect the genetic material, detect the proteins. It takes some time before we're able to detect them in our body. So keep that in mind. You may take a test, the test may come back negative. A few days later, the test could come back positive. So it's important to keep in mind there's the window period. For protection, the two best vaccines that we have, the Pfizer BioNTech 2-dose vaccine and the Moderna 2-dose vaccine. These are very, very effective vaccines. they require 2 doses to complete the series. Then we get boosters, which we'll talk about in just a minute. These vaccines are very, very, very helpful. Not only did they initially protect from getting infections, but what they've continued to do is protect against severe disease and protect against death. Now, the problem is, as these new variants emerged, the ability to protect from infection was reduced, but these vaccines continue to protect against severe disease and death. These are some data that came from the Centers of Disease Control. And what they're looking at are rates of new COVID infections in nursing home residents. So we're looking at a period of time. This is from earlier this year in February going into March. The solid blue line, these are individuals who are unvaccinated. So if we look at the number of cases, and again, these are cases, number of infections per 1,000 nursing home residents. And we start off where there are 12 cases per 1,000. It goes down over time. The individuals who completed the primary series, in other words, they just had the 2 doses of the vaccine, it's slightly less, but not really that much of a difference. So again, this is showing reduced protection from infection. These vaccines continue to protect against hospitalizations and death. But what happens when we look at people who had a booster? The dotted line shows the infection rate is reduced in half. So getting that booster gives additional protection from getting infected. Well, is more better? Sometimes it is, sometimes it's not. This is an example where it probably is. So again, if we look at nursing home residents, these are individuals, the control group, these are individuals got 1 booster compared with people who got a 2nd booster. And so if you look at the number of infections, 101 versus 75. So it's a slight reduction in the number of infections. Hospitalizations, 9 compared to 3. So we see a 3-fold reduction in hospitalizations. Deaths, 8 compared to 1. Rather dramatic reduction in deaths just from getting that extra booster, and severe outcomes, 16 versus 4. So that extra booster gives us extra protection. But we've got one step better here. We've got these new bivalent vaccines, and these vaccines, we call them bivalent because they come from 2 coronavirus sources. It's a mixture of vaccine that came from the original coronavirus combined with a vaccine made from 2 of the Omicron subvariants. So it is predicted that this new vaccine will provide better protection as Omicron continues to mutate, which it is certainly doing. And this booster can be given to children down to 5 years. So protection, again, is the best approach, but sometimes, as we can see, we get breakthrough infections and we may need to be treated. So for those of you who like chemistry, this is the structure. As I said, I'm going to make you mini scientists. I'm going to give you a quiz on this at the end. No, just kidding, no quiz. But this is the drug remdesivir. This is the first drug that was approved by the FDA to treat coronavirus. Now, the problem with remdesivir is it's only administered intravenously. So when we first started using remdesivir, we were using it in hospitalized patients. And the benefits were modest. It wasn't the magic bullet we were looking for. It did help, but it didn't help a lot. And part of the reason is because it was being given to people with more advanced disease. And one of the things that's important with coronavirus is getting treatment early. So by the time they were hospitalized and got access to the remdesivir, they were usually in later phases of the disease. But what would happen if we could give remdesivir sooner? What would happen if we could give it to people when they were outpatients? And so this is a study, and let's just look at this panel. You're probably scratching your head, what the heck is this? Well, let me explain it to you. In this particular graph, we have a placebo group, we have a remdesivir group. We're looking at the number of severe medically attended visits. So these are hospitalizations and death. And so if you look at the placebo people who did not get the remdesivir as outpatients, increasing numbers of hospitalizations and death. Whereas when we look at the people who got the remdesivir, now again, they're getting it earlier. They're getting it earlier. And we see a really profound, you see how flat this curve is, the number of hospitalizations and deaths. This is a 4 to 5 reduction in the rate of hospitalizations and deaths when we give remdesivir earlier, which again, that's a challenge because this drug has to be given intravenously. What about the monoclonal antibodies? There are advantages and disadvantages. One thing that's really cool about these monoclonal antibodies, if we use them for treating coronavirus, they last a long time. You only have to get one dose of the monoclonal antibody, and they can continue to work. They'll clear the infection. People get better. They don't require any additional doses. They're also not only effective in treating an infection, they're effective in prevention. We actually have a product which is a combination of monoclonal antibodies used for people who may not respond to a vaccine. Maybe somebody has cancer, maybe someone has an autoimmune disease, and the vaccines are not going to give them protection. You can use this product that will give them long-lasting protection. But there's some problems, and that newer COVID variants may be resistant to these monoclonal antibodies. They may not work. They also have to be administered, of course, intravenously. And just as we saw in the case of remdesivir, this is a problem. So they have to be administered intravenously, and they must be administered shortly after the symptoms develop. So this has been a challenge where you have this really, really valuable treatment, but again, accessing it because of it has to be administered intravenously can be a challenge. And unfortunately, this particular monoclonal antibody, bebtelovimab, which was approved earlier this year, it was effective against the original Omicron variants. But since that time, Omicron has continued to evolve. There are new variants that this product is not effective against. So that's the limitation. Let me go to this last section and finish up so we can possibly take some questions before we can get to our other speakers. Paxlovid, an oral treatment for COVID-19. Again, it's taken orally twice a day for 5 days. This is a real game changer. It's not intravenous, it's oral. You can just get it from your pharmacy. But like other treatments, we need to start it within 5 days of signs or symptoms of COVID-19. Now, one of the problems with Paxlovid is it's actually a combination of drugs. It has the potential to interact with other medications that the individual may be on. So it's really critically important that your physician, that your pharmacist know all medications that you're taking, including over-the-counter medications, to make sure that you'll be able to take Paxlovid safely. The good news is these drugs, both Paxlovid and remdesivir, they're effective against any variant. So you can pick any letter in the Greek alphabet you want. These drugs will have activity against those variants. If you don't have a medical provider, you don't have a doctor or nurse practitioner that can call in a prescription for you, you can go to your pharmacy. You can actually get tested at the pharmacy, and the pharmacist can give you a prescription or give you a dose, series of doses for the Paxlovid. One last series of data here. This was published in the New England Journal of Medicine. This was a study looking at COVID and Paxlovid. Let's just look at this top panel. Patients 65 years of age or greater. So these are high-risk individuals for hospitalization or death. The people who did not take Paxlovid, over time, what do we see? Increased hospitalizations or death. Those who took the Paxlovid, you see the line is very flat. Very few hospitalizations and deaths. As a matter of fact, Paxlovid reduced hospitalizations fourfold among these older individuals. It reduced death fivefold in this group. So I'm gonna stop there, and hopefully we have time for maybe some questions, or if something was in the chat. I couldn't see the chat. We do have some very exciting presentations to follow, but if there's some time, I will be happy to take some questions. I'll try to see if there's anything in the chat. So thank you very much for your time and attention.
Well, thank you so much, Dr. Crawford. And just a reminder to our audience members to put any questions that you may have in the chat box, and we will pose that to our presenters. So just drop that in the chat box, and we will ask our presenters for your answer your dying questions here.
If anybody, you're also free. If you have the ability, you can just come off mute and ask the question if that's allowed. I don't know if you have the ability to do that, but feel free to do that as well.
I think because we're in webinar format, they can't do that.
They can't. Okay.
But what do you see on the horizon? I mean, we've made it through somewhat of one pandemic, and we've got monkeypox, we got RSV, and we've got all these different names. How do we kind of get ourselves through this with all these different new things coming at us?
Well, again, a respiratory syncytial virus is not a new virus. It's been around for quite a while. It's particularly problematic among children. Excuse me. There's a lot of work being done for improved RSV vaccines. So that's something that's being worked on. Monkeypox is not a new virus either. The problem with monkeypox, which I think bothers me, is that this is a virus. We actually have a vaccine. We actually have some drugs that we think are effective against monkeypox. But if you go to Africa, either Central Africa or West Africa, where these different strains of monkeypox come from, nobody's getting any treatment. Nobody's getting vaccines. And so you go to parts of the world where we have the infections like Ebola virus and other types of infections. And, if you're in a part of the world which is a developing country, you're out of luck. And nobody is interested in developing treatments or vaccines until these infections become a problem to wealthier parts of the world. So when monkeypox pops up in Europe and pops up in the US, now we have a problem. Now we have a crisis. As long as it's causing problems in sub-Saharan Africa, not an issue. As long as it's a problem in Southeast Asia or Latin America, not an issue. But then when it starts coming up and affecting us, then we have a problem. Then we have to put research into coming up with vaccines and medications. So if we want to keep following that model, we're going to keep having serious problems. Excuse that noise you may hear in the background. There's some construction work being done at my house. So those are my thoughts on that issue.
Thank you so much. Well, if we get any more questions, you can always.
I'll try to stick around. I got to prepare for another meeting, but I'll try to stick around and try to hear some of the other presenters and also if any questions pop up. But thanks again for inviting me to participate in this really excellent forum.
All right, and to our audience members, if for some reason you can't use the chat box, there is the Q&A box, and we'll look in there and pull out your questions there. So thank you so much, Dr. Crawford, for your presentation. So next up, we're going to have Attorney Jerry Leakey, who is in our Equal Justice Works program here at Legal Aid Society of Palm Beach County. Jerry is a proud graduate of the University of Central Florida and the Florida A&M University College of Law. He's very active in many organizations, including the Palm Beach Knights, Global Health Community Service Incorporated, the Young Lawyers section of the Palm Beach County Bar Association, and he's on the board of Palm Beach County Hispanic Bar Association. Jerry's worked in a number of projects here at Legal Aid dealing with many topics, including healthcare law, small businesses, and disaster assistance while working at the Legal Aid Society of Palm Beach County. He is currently in our Equal Justice Works program and serves as a fellow in our elder law project. So without further ado, Mr. Leakey.
Good afternoon. Go ahead and share everything real quick. Should be good to go now. Okay. So I'm gonna get going quick. That way we don't cut on time any. So I'm gonna be discussing some scams, particularly with a focus on COVID-19 and Medicare scams, but I do want to talk about spoofing first real quick because it's being used in a lot of these areas. So according to the FCC, spoofing is when a caller deliberately falsifies information transmitted to your caller ID. In other words, you get a call and all of a sudden it's got your number on it or somebody else's number or some name of a company. It may not be the person calling. So you gotta always be cautious about who you're talking to, regardless of what your caller ID says, basically. How to avoid it. You may not be able to tell right away if an incoming call is spoofed, but be careful about responding to any requests for personal information. Don't answer calls from unknown numbers. And if you do answer such a call, hang up immediately. If you answer the phone and the caller or recording asks you to hit a button, they generally advise not to hit that button because that's kind of an automated way that the scammers are able to find if a number is being used and if they'll interact with them. And if you do, then you could get put on one of their lists, one of the scammers' lists, to then receive more and more calls down the line, is what the current thought is on that from everybody, the government and whatnot. So do you respond to any requests? If you do not respond to any questions, especially those that can be answered with a yes or no, the concern there is that they don't want you to be able to record your yes or your no, and that be used against you in something that they say, oh yeah, well, you agreed to, have your house remortgaged or something like that. So never give out personal information such as account numbers, social security numbers, mother's maiden name, passwords, or other identifying information, including even the questions that they ask about, what hospital were you born in? What was your first pet's name, what street did you grow up on, all those security questions that they ask you that, it's a constant compiling of information when the scammers are able to get it, where they, put it in their database, and that database may be spread on the web, on the dark web. It may be just passed amongst an office of a bunch of scammers, but there are offices set up this is their job to scam you, unfortunately. So beware sharing information is the premise of this portion. If you get an inquiry from somebody who says they represent a company or a government agency, hang up and call the company back on the number that is that number, whether it's from the phone book, an account statement that you have, a previous contact that you've made with them. If it's a credit card, call the number on the back of your card, whatever. Call a number that you're confident that is the source, because and the scammer, if it is a scammer, they may say, oh, well, you're going to have to wait on the phone to go through a phone tree for 20 minutes or whatever. It's okay. At the end of the day, it's okay. Take your time. Don't let them push you into giving your information away for them to steal your identity or buy something on your behalf or whatever. And, you just don't want to hurt yourself. Don't use caution. Don't let them pressure you. And you can talk to your phone company or use an app or something like that to try and use blocking tools to try and block scammers. I know a lot of the cell phone companies now do have some of those services built in, where I'll get calls all the time that says scams likely. So just be aware that stuff's out there. And for more information about robocall blocking, you can log on to the fcc.gov/robocalls. Okay, how to protect yourself and your family from coronavirus fraud. FDA advises consumers to be cautious of websites and stores selling products that claim to prevent, treat, or cure COVID-19. So stick to reliable sources. Talk to your doctor, check the FDA's website, listen to people like Dr. Crawford. Don't listen to ads that you found on a social media site or anything like that tries to make these wild claims of, we've got the new quick fix for coronavirus, or basically, if it seems too good to be true, it probably is. So avoid those miracle cures. Some people have celebrated their COVID-19 vaccinations by oversharing. Please don't post a photo of your vaccination card on social media. That's a bad idea. You're sharing too much information that could be inviting identity theft. Vaccination cards have information, including your full name, your date of birth, where you got your vaccine, and the dates you got it. When you post it on those social media sites, you may be handing that valuable information over to someone. The FTC had a great example. They said, think of it this way: identity theft works like a puzzle made up of pieces of personal information. You don't want to give identity thieves the pieces they need to finish that picture, because in that case, they could, use that to open accounts in your name, claim tax refunds for themselves, and engage in identity theft in whatever capacity it'll be to your detriment. So protect your information is very important. So free COVID test scams targeting people on Medicare. So there are plenty of scams dealing with Medicare, and time. Okay, we're good. Scammers have been targeting Medicare recipients with fake offers to get free COVID tests. I mean, that may be dwindling a little bit, but we're still here. So they could still be asking for that, but don't give your information. They're running calling and running websites, online and television ads to try and convince people to give them the Medicare information. Your Medicare information is just as valuable as your Social Security number. Don't give it out. If you or someone you know is covered by Medicare, here's how to avoid these scams. There have been COVID tests given out for free, but they're from a reliable source. Again, go directly to the source, to the government source, to find out how you can get it. And in many cases, that could mean even going to your pharmacy and seeing what you're eligible for with your Medicare.
Jerry, if I could interrupt you one moment. I think we're
Absolutely.
still on your cover page of your PowerPoint.
I'm sorry?
We're still on the cover page of your PowerPoint. If you could,
Oh. I don't know what's wrong then. That's not great. Okay. More slideshow options. Okay, let's try and end it and start again. Do you see this? Or are you just on the front page?
We see it, it says on spoofing now.
Okay, spoofing's where we went. So we'll go this route, and then let me just see if I can do a slideshow again and see if it moves. Now is it moving?
No, we're still at the FTC.
Okay, then I'll just do it that way then. Not a big deal.
Okay. Thank you.
And show. Okay. Where was I at? I was. I think I was here. Okay. Never give your Medicare or other personal information over the phone to anybody who calls asking for it. We're really going to want to be concerned about fraudulent charges, because if you give your information out to Medicare to a scammer or somebody, they can charge up your Medicare, and you may not be able to get something, a medical supply or something that you would be eligible for later in life when you need it, if it's already been charged and you're no longer eligible for it. So you want to protect that number. Like I said, it's probably just as valuable as your Social Security number, because you don't want people getting into your funds, just like you don't want people cutting into your medical care later in life. I am cutting it close. So I'm going to rush through this part real quick and then hit my last slide. Potential Medicare scams to avoid. They'll call saying Medicare is issuing new cards. Give me your information. Medicare coverage is about to be canceled. Give me your information. You can receive early access to special vaccines. Give me your information. If you have an appointment we can make an appointment for free genetic testing. Give me your information. If you qualify for free medical supplies, you're eligible for a refund. You're pre-approved for a cheaper and better plan. Cool. All of those scenarios sound fantastic. Don't give them your information. Call up Medicare directly. Just go to the source directly. Hang up on them. Too good to be true. It probably is. Okay. Finally, if you do receive Medicare scam calls, callers can be persuasive, threatening, aggressive, but it's important to keep calm and remember they can't do anything to you without your information. Medicare is not going to call you asking what your Medicare number is. Don't give out your personal information. They already know it. If you're expecting a call from them, it's one thing because you've already started a conversation with them, but it's a whole nother if you're just being cold called. So don't give out your name, address, Medicare number, Social Security number, any of that stuff. Hang up the phone, trust your instincts. You can always reach out to Medicare directly at medicare.gov or by calling 1-800-MEDICARE. Do not call back a number of a person that called you, even if they tell you I'm with Medicare and here's my number to call me back, call the main number back. Report the spam call. You can do that through 1-800-MEDICARE or the fraud hotline at 1-800-HHS-TIPS. Warn your friends and family, because these scams are constant and they're consistently going at a group of people. They'll go with the same scam. Always remember, Medicare doesn't call you uninitiated. You call them. Above all else, keep in mind that Medicare will not call you to sell you anything. And if you get a suspicious call from someone claiming to be Medicare, hang up. Okay, I think that's my 10 minutes. Thank you so much.
Thank you, Jerry. We appreciate you. Again, if you have any questions, we're finding that the Q&A box is working and not the chat box. So please put your questions in the Q&A box. Dr. Crawford, are you still there? We do have a question for you. Well, I will contact.
Yes, I am here. Sorry,
Sorry.
had a hard time getting on.
That's okay. So one of our attendees asked, what are some of the concerns as it relates to COVID vaccines for kids under age 13?
So the vaccines that we have now are very safe for kids. I think it's, one of the things when we think about the safety of these vaccines is that they have been used in millions of people. And that's across the globe. So different, we have good data in Black folk and Latino and Indigenous, Asian, all over, all different groups. The safety of these vaccines is really pretty phenomenal. I would suggest that the person talk to their pediatrician, again, to get some very specific advice. But these vaccines, and again, for that particular age group, we've actually even had available vaccines longer, so we have a longer track record of safety data. So I don't think anyone should hesitate. Maybe there may be some unique medical issues that a particular child may have, and I think they should discuss that with their pediatrician. But they're very safe vaccines.
Thank you so much.
Mhm.
All right, we'll keep moving on. So want to make sure that we have everyone finished by 1 o'clock. So our final presenter is Iris Collins Cruz, and Iris is one of our staff attorneys in our elder law project. And she concentrates primarily on litigation, patient rights, resident rights, and estate planning for seniors. She's worked as corporate counsel for healthcare corporations and long-term healthcare facilities, where she's oversaw litigation and advised leadership and senior management on healthcare regulations and compliance. She also has served as an adjunct professor of paralegal studies at City College in Fort Lauderdale, Florida. Ms. Cruz is a member of the Florida Bar and has been admitted to practice in United States District Court, Southern District of Florida. She's originally from Indiana and obtained her Bachelor's of Science degree in management from Indiana University. She started her legal career with the Broward Public Defender's Office as the Assistant Public Defender after graduating with honors from Florida A&M University College of Law in 2009. So without further ado, Iris Collins Cruz.
Thank you so much. So I am going to try to be brief, but I still want to make sure I go over the estate planning, and with COVID is very, very important that we actually, do estate planning, especially the power of attorney. So let me start off and make sure you guys can see my screen. And I believe now you can see my screen.
Yes.
Okay, perfect. So the coronavirus, it has been here for a while. I think it may be here with us to stay. But, it's a reminder that life is unpredictable and it's important to be prepared. And it brings home the reality that we could get very, very sick quickly. So whenever you have threats to life and finances that's posed by a pandemic, you want to make sure you have an estate plan. Despite COVID-19, the overall prevalence of estate planning has substantially changed since 2020, and it's still considerably lower than in previous years. If you look in 2017, the percentage of American adults with estate planning documents actually was at 40%, and in 2021, the statistics show they're under 40% going to 30%, which is something that we need to do more of and not less of. So when you talk about estate planning, in regards to engaging in estate planning, we see that the coronavirus has caused a greater need for it. It is more presentations on it. However, they haven't really taken action. If you look at the statistics, and this is from www.caring.com, and they did a survey after COVID-19 for estate planning, you'll see that about 65% have not taken any further action other than discussing it. So, you got to actually carry through. I know when you start the conversation, it really feels uncomfortable because you're thinking about mortality. You're thinking about something that's uncomfortable, the concerns that, you might get sick or you might pass away, but it's really, really important. So what you need to do when you start having those conversations is, especially when you're looking at the power of attorney, you need to decide what people in your life will make medical and financial decisions for you if you're not able to do it yourself. Now, I will tell you, when I say medical and financial, although we're talking about healthcare, the financial is a part, because sometimes With healthcare, it is a finance situation. You may have to have long-term care, or it may be very costly. So you want to make sure the person that you have to make your medical decisions also are trustworthy, because financial decisions may have to accompany that. You also want to determine who can speak on your behalf and who will actually get your property, and that's personal as well as real property, upon your passing. That's really important. Now, the power of attorney, I always tell my clients, this is the single most important estate planning document that you can have. You have to have a power of attorney, no matter how healthy you are. And I honestly believe no matter your age. The reason why it's so important is because it gives someone authority to act on your behalf when you're not able to act on your behalf. And most of the time, unfortunately, some of my clients come to me and ask for a power of attorney when they really need it. But usually when you really need a power of attorney, you don't have capacity to make your own decisions. So as such, you don't have capacity to actually enter into a power of attorney. You don't have capacity to execute it. So it's really important that the first document for your estate planning, when you have that conversation, is to think about who can act on your behalf in the event you can't act on your behalf. Now, in the state of Florida, a power of attorney has to actually have 2 witnesses, and it has to be notarized. So that's very important. A lot of times you may see a power of attorney online, but if it's not actually executed properly, then it's not going to work. Now, there are 3 types of power of attorneys. The general power of attorney, which allows a person to handle pretty much all your affairs. And however, if the principal becomes incapacitated, it's terminated, meaning if they don't have capacity, then it's terminated. Your authority is terminated. You can only act as long as the person has capacity. Now, a special or limited power of attorney is something, let's say if you were doing a real estate transaction, or if you just needed the person to act on your behalf for a limited piece of time. But the durable power of attorney, that is the power of attorney that actually lasts after a person becomes incapacitated. With that document, if you have a person that you trust as your power of attorney, and if something happens where you don't have capacity, they could still act on your behalf, and you could forego having to go through the lengthy process of a guardianship, because that's what happens if you don't have a power of attorney and you don't have capacity for your loved ones to be able to act on your behalf. You would have to go through with the guardianship. So I'm going to kind of speed up a little bit because I know my time is running on. I want to spend a lot of time on the power of attorney just because I think it's so important. The other documents you can receive are healthcare surrogate, and I'll just stop sharing now. It's a healthcare surrogate, as well as the living will is a document that your loved ones will know what you actually want to happen in the event you need artificial substance or hydration. If you want to have artificial substance, they won't have to make that decision. That's what the living will does. And lastly, the last will and testament actually determines who gets your property when you pass on. And a lot of times people say, hey, I don't have much, I don't need a will. You do need a will, because if you have $10, you have something. If you have your furniture, your bank accounts, or, you may have your cars, anything, you want to make sure you have a will, so that way your loved ones will know who you want your worldly possessions to belong to, and more importantly, so you can dictate who they belong to. Because if you don't have a will, Florida is going to give you a will per the statutes, because that is how your property will be distributed. So get a power of attorney, definitely, and thank you so much. Do anyone have any questions?
Any questions out there? Put them in the Q&A box. All right. Just a little plug about Legal Aid Society of Palm Beach County while you think of your questions. We are a free nonprofit organization that provides free lawyers to members of the community. We're funded by a number of grants. In particular, the Eldorado Project is funded by the Erie Agency on Aging. And so we provide free services to anyone over age 60 in Palm Beach, Martin, Hendry, Okeechobee, St. Lucie, and Indian River counties. And so we'll provide you with a simple estate planning if you have an issue with your house, or issue where you need to, you're facing eviction, or you have an issue with a debt, or you're facing a scam, or maybe you're you need help with a guardianship or guardian advocacy. Our staff is able to help you with that. So we do have one question in the Q&A, and so the question is for Iris. What is the difference between a DNR, which is a do not resuscitate, and living will?
So the difference is that a living will actually dictates that you don't want to have any artificial substance. It's actually something you can prepare and give to your loved ones. A do not resuscitate is actually a form that you have to get from a doctor, and it essentially tells any facility, healthcare facility that you give it to, that you do not want to be resuscitated. And it's actually, if the facility, let's say a nursing home, resuscitates you and you have a DNR, then it can be liability on the company. So when you get the living will, even though you're putting forth what your wishes about artificial substance and hydration, that is not the same as a do not resuscitate. So just keep that in mind.
All right. Well, we thank everyone for joining us today. I think today has been a wonderful opportunity for you to learn a lot about the COVID vaccine and your rights if you're impacted by a scam, and to learn about the different healthcare planning tools that are available if you need that. So I want to thank again Legal Aid Society for sponsoring this, Global Health and Community Services, Florida Statewide Organization of Omega Psi Phi Fraternity Incorporated, Quantum Foundation, and Area Agency on Aging. And we look forward to having you for future programming. Have a great day.
Thank you.